Hello, everyone. This is Dr. Alicia, and I'm so thankful you've joined me today for a conversation that could truly change lives. Before we begin, if you're new to our community, please consider subscribing and turning on notifications so you never miss out on our helpful health updates. And to our returning viewers, thank you for being such a valued part of the Dr. Alicia's MedTalk family. If you find this video helpful, please give it a like and let me know in the comments where you're tuning in from. I love hearing from all of you across the globe. Today, we're going to discuss a condition that remains frighteningly under-recognized despite its severity: pancreatic cancer. Often labeled the silent killer, pancreatic cancer continues to fly under the radar even as it surpasses breast and prostate cancer in death rates in many countries. It's estimated that more than 65,000 lives are lost to this disease each year in the US alone, and tragically, it carries a 5-year survival rate of only about 12%. What makes it even more heartbreaking is that around 80% of people miss the early signs, brushing them off as trivial or everyday discomforts. But here's the empowering part. Studies show that noticeable symptoms often begin to surface 3 to 6 months before diagnosis, offering a vital chance to catch this illness early. And with pancreatic cancer, early detection is absolutely everything. So, let's start by understanding the role your pancreas plays in your body. Tucked behind your stomach in the upper abdomen, this unassuming organ has two incredibly important functions. It regulates blood sugar by releasing insulin and other hormones, and it produces enzymes that break down fats, proteins, and carbohydrates during digestion. Because of its hidden location, tumors can develop quietly and undetected for months, even years, making the early warning signs that much more essential to recognize. In this video, I'll be walking you through 8 warning signs that should never be overlooked. Even recognizing just 3 of these symptoms together has been shown to improve early diagnosis rates by nearly 70%, so please listen closely. First on the list, digestive disturbances. When cancer interferes with the pancreas, it can drastically reduce enzyme production, cause blockages, and wreak havoc on digestion. This might present as constant nausea, bloating that doesn't subside, reduced appetite, unintentional weight loss, or stool that appears pale, greasy, or unusually foul-smelling due to poor fat absorption. Any ongoing changes in your digestive routine, especially lasting longer than 2 weeks, should be brought to your doctor's attention, particularly for those over 45. Second is unusual fatigue. I'm not talking about feeling tired after a hectic day or a restless night. This is a deep, unrelenting fatigue that doesn't go away with rest. Cancer cells use up nutrients and energy, weaken your immune system, and interfere with digestion, all of which contribute to extreme tiredness. If you find yourself waking up feeling exhausted, struggling with routine tasks, or noticing a decline in energy that persists over time, it's time to investigate further. Third, fevers and chills that don't follow a typical infection pattern can also be an early red flag. Pancreatic cancer may provoke immune responses that lead to cycles of low-grade fevers, sudden chills, and night sweats, especially if the tumor causes inflammation or jaundice. These symptoms often appear without a clear explanation and may last longer than fevers caused by common illnesses. Fourth on our list are blood clots, which are surprisingly common in pancreatic cancer patients. This condition can cause your blood to become overly prone to clotting, a state called hypercoagulability. Deep vein thrombosis, DVT, may appear as swelling, warmth, tenderness, or discoloration in a limb, usually a leg. If a piece of the clot travels to the lungs, it can cause a pulmonary embolism, which is a medical emergency characterized by sharp chest pain, shortness of breath, or rapid heartbeat. If you notice any symptoms like these, especially out of the blue, don't wait. Seek emergency care. Fifth, swelling in the upper abdomen, especially on the right side, can signal that a tumor is blocking the bile duct near the head of the pancreas. This obstruction can lead to enlargement of both the gallbladder and liver. Sometimes these changes can be felt physically or seen through imaging like CT scans or ultrasounds. If you feel discomfort or tightness under your ribs that doesn't go away, especially with other symptoms mentioned here, talk to your physician. Sixth, persistent bloating and gas can also be a sign of trouble. This might manifest as feeling full quickly after small meals, a swollen belly, or bloating that lingers despite using common remedies. When your pancreas stops producing enough enzymes, it's harder to digest food efficiently, causing discomfort and a sense of heaviness. If over-the-counter treatments don't work and these symptoms persist for weeks, it's time to look deeper. Seventh, abdominal and back pain are also symptoms worth noticing. When cancer is located in the body or tail of the pancreas, the pain can feel like a dull, persistent ache in your upper belly or radiate to your back like a band. Some describe it as gnawing or pressure-like, often worsening after meals or when lying down. Unlike ordinary backaches, this type of pain doesn't respond well to rest or pain relievers and tends to grow worse over time. And finally, eighth, dark-colored urine. This often results from a buildup of bilirubin, a yellowish compound your body usually eliminates through bile. If a tumor blocks your bile duct, bilirubin builds up and changes the color of your urine, making it dark yellow or brown, often resembling cola or strong tea, even when you're well hydrated. This can occur before you notice other jaundice symptoms like yellowing of the skin or eyes, making it an early clue that something is wrong. While any one of these signs may have a benign cause, it's when they appear together, especially in clusters of 3 or more, that the concern becomes more urgent. For instance, digestive issues combined with fatigue and dark urine or unexplained weight loss alongside back pain and bloating should prompt a visit to your doctor. Now, let's talk about risk factors that can elevate your likelihood of developing pancreatic cancer. Age is a major one. Most cases occur after 65. A family history of the disease, smoking, which doubles or triples the risk, chronic pancreatitis, obesity, a diet high in processed meat, type 2 diabetes, especially if it develops later in life, and certain inherited genetic syndromes like BRCA1/2 or Lynch syndrome, all contribute to your risk. If any of these apply to you, I encourage you to discuss potential screenings with your doctor. So, when should you seek medical advice? Don't ignore symptoms that last more than 2 weeks, particularly if they're unusual for you. Persistent abdominal pain, darkened urine, noticeable weight loss, or a cluster of these signs, especially for people over 45, should not be brushed off. When you visit your doctor, they may run blood tests to evaluate liver function or check for tumor markers, followed by imaging tests like CT or MRI scans, or even an endoscopic ultrasound. In some cases, a biopsy may be recommended to confirm a diagnosis. While hearing the term pancreatic cancer can be scary, the good news is that treatment options continue to improve. When caught early, surgery may be possible to remove the tumor. Other treatments include chemotherapy, radiation therapy, targeted drug therapies tailored to genetic markers, immunotherapy, or participation in clinical trials exploring new approaches. A multidisciplinary care team, consisting of surgeons, oncologists, dietitians, and more, typically offers the most comprehensive and effective care plan. That's why early detection is so critical. If the cancer is caught before it spreads, the 5-year survival rate improves to around 44%, compared to just 3% once the disease has metastasized. Prevention also plays a powerful role. You can lower your risk by quitting smoking, eating a diet rich in vegetables, fruits, and whole grains, maintaining a healthy weight, staying active, moderating alcohol consumption, managing diabetes well, and getting regular checkups, especially if pancreatic cancer runs in your family. These lifestyle choices not only help protect against cancer, but also support your overall vitality. Let me leave you with this. Pancreatic cancer may be called silent, but as we've discussed today, it often whispers before it screams. By tuning into your body and recognizing these early signs, whether it's persistent digestive discomfort, unrelenting fatigue, fevers, bloating, unexplained back pain, dark urine, swelling, or unexpected blood clots, you empower yourself to act. You don't need to panic at every minor symptom, but when several of these signs appear together and persist, it's time to speak up. Knowledge, especially when it comes to health, is one of our greatest tools. So, I encourage you to share this information with your loved ones, especially those over 45. Thank you so much for spending time with me today on Dr. Alicia's Med Talk. If this video brought value to you, please give it a thumbs up and subscribe for more empowering health content. I always look forward to reading your thoughts in the comments below. Until next time, stay informed, stay proactive, and I wish you the very best of health.